Welcome to the Nutrition Research Update from the Renaissance Institute of Integrative Medicine. I'm Dr. James Meschino. Our topic today is natural relief for night pain and night pain-associated insomnia. Now, 110 million Americans suffer from chronic pain, and people who are in either chronic or acute pain know that pain is usually worse at night. That's just the way the body's circadian rhythm is set up. And so either the pain keeps people awake and they can't get to sleep, or they fall asleep and then the pain wakes them up. In either case, if you don't sleep properly, it leads to ongoing fatigue, personality changes that can lead to despondency, and even depression. That's not uncommon in people that have had pain for a long time. And when you feel that way, there's lack of compliance with other treatment recommendations to help you get better. So medical doctors typically prescribe pain-killing drugs and anti-inflammatory drugs for people who are in pain. Drugs like acetaminophen, non-steroidal anti-inflammatory drugs, and narcotic drugs. And we're going to look at some of these. The problem is that if you use these drugs on a regular basis over a long enough period of time, you're usually headed for some kind of adverse side effect that actually makes everything worse. So, for instance, let's look at acetaminophen. It is known to do extensive damage to the liver and also to a certain degree to the kidneys. But right now, just using acetaminophen during using the regular dosage that's recommended is now the leading cause of drug-induced liver failure in North America. 50% of all cases due to acetaminophen, just chronic use, just taking it on an ongoing basis. It also does kidney damage, and so we're seeing an increased number of people over time needing dialysis because they've had damage. It's called analgesic nephropathy, the damage that's been done. So using acetaminophen on two regular bases sets you up for some very serious problems. Doctors know this. They also know that non-steroidal anti-inflammatory drugs, everything from aspirin to ibuprofen to Voltaren to indomethacin and Celebrex and Vioxx, that these drugs cause stomach irritation, but not just irritation, they can lead to actual bleeding and erosion of the intestinal lining. 10 to 20,000 deaths each year in the United States are directly attributable to internal bleeding from these types of medications, people taking them on a long-term basis. And they also do a fair bit of kidney damage. So analgesic nephropathy can also result from the use of any type of non-steroidal anti-inflammatory drugs, as well as acetaminophen, leading to the need for dialysis down the road. A lot of kidney damage is showing up. And certain types of non-steroidal anti-inflammatory drugs, and aspirin would be the exception, are also linked to an increased risk of sudden death heart attack from thrombosis. And so doctors have been told, in fact, not to prescribe these drugs to patients that have any history of heart disease. So if you have someone who's older and they have arthritic pain and they've already had a heart attack or they're at a high risk for a heart attack, they're not supposed to be taking those drugs. It increases the risk of having a sudden cardiac event. And they can also increase risk of high blood pressure, congestive heart failure, and some other problems. Even low-dose aspirin is linked to internal bleeding, both intestinal bleeding, also bleeding into the brain. So many of the authoritative bodies are now saying we should not be telling people to take even low-dose aspirin to prevent their first heart attack, because we're seeing that the cost of this is a large number of people ending up with internal bleeding, both intestinal bleeding, also bleeding into the brain. So it's actually not worth the trouble to do it because the risk is actually great. Now, if someone's already had a heart attack, taking an aspirin to help keep the blood a bit thinner has been shown to be valuable. So only in select people is even a baby aspirin considered to be a safe, or not even safe, but probably a warranted thing that would help to reduce the risk of vascular disease. With narcotic drugs like Percodan, Percocet, Oxycodone, Oxycontin, and so on, we're seeing now major problems, escalating problems with drug addiction and physical dependency. Because when you take those drugs to block pain, there's euphoria. The first person feels stoned, they go into a trance-like state, and they actually could start to get addicted to it. They try to go off it. The opioid receptors now demand this sensation. So there's now physical dependency. The person has withdrawal symptoms. They need their fix at any cost. And when the person's now experiencing this type of euphoria all the time in a stone-like state, their motivation drops. Their productivity drops off. They lose their job. Their lives become wasted. And I'm not overstating the facts. Governments right across the board are now reining in how they're allowing doctors to prescribe narcotic drugs right across the board, states and provinces across North America. Because narcotic drugs originally were designed to be given to people with intractable pain, particularly cancer patients. And then in the 1990s, governments opened up the window and allowed doctors to start prescribing narcotic drugs for people with, musculoskeletal problems, injuries, car accidents, and so on, chronic pain. And then we started to see all these addiction problems and all these societal problems that are linked to it. Now, that's the bad news. The good news is that in recent years, there's been an amazing breakthrough. We see that the ingredients in a natural herb called the California poppy, which is actually the state flower of California, can relieve pain, relieve night pain, and help to induce a good night's sleep without producing any euphoria. You don't get high, you're not stoned. So there's no addiction potential. You don't feel stoned, there's no physical dependency, and there's no liver damage, there's no kidney damage, there's no risk of damaging your cardiovascular system or having a sudden death heart attack. So why is this important? Well, the California poppy helps to induce sleep and block pain. And because pain is worse at night, the California poppy is the perfect natural solution for night pain and night pain associated insomnia. Because if that pain is bad enough, you can't sleep. And if you're sleep deprived, it impedes healing. You become despondent, fatigue, lack of motivation, depression, and all those things we talked about. So studies have shown that supplementation with the California poppy relieves pain at night and allows the person in acute or chronic pain to fall asleep and remain asleep, because it also has sleep-inducing effects. So the result is that you respond better to the treatment that you're undergoing through the day. You wake up refreshed, you're motivated, and you have the energy to undergo treatment and to try to have a productive life. And sleep allows better healing to occur. That's when your body actually heals itself, is when you're sleeping. And you're not depressed, there's no major personality changes, there's no destructive behavior, you're not stoned, you don't walk around like a zombie, you're not hooked on the high, no damage to your kidney or your liver, there's no cardiovascular risk. So how does California poppy do this? Well, there are active ingredients in the California poppy, which are isoquinoline alkaloids. And what do? They bind to the opioid receptors in the central nervous system and they block pain without any euphoria, without feeling stoned, without putting you into a trance-like state. They also attach to serotonin receptors, which also help to induce sleep and give you an improved sense of well-being. But you need the right dosage and the right standardized grade of the California poppy to get this effect. So products like the government-approved niquinidol, for instance, contains the exact dosage and the right standardized grade of the California poppy that's been shown to be effective in human pain research. So you can't just use any California poppy that's been ground up and stuck into a pill or a capsule. You have to use products like niquinidol. So for instance, Health Canada has given niquinidol a coveted natural health product number based on the efficacy of the product, the safety of the product, and the right dosing of the product, the standardized grade that was used. So it's one of the very few California poppy products that's sort of government approved for pain control and to overcome insomnia from pain. And it's also now available in the United States and other countries. So products like niquinidol provide doctors with a safe and effective alternative to overprescribing acetaminophen, non-steroidal anti-inflammatory drugs, and narcotic drugs for the management of night pain, whether it's acute or chronic. Now, there are some precautionary notes. You can't use California poppy products like niquinidol at the same time as you're using a narcotic drug or sleeping pills or anti-anxiety drugs, right? So if a person has a dependency already on a narcotic drug, they have to work with their medical doctor to slowly get themselves weaned off while they're introducing niquinidol as the evening dose substitute. Also, taking niquinidol through the day is probably not the best idea because it does have sedative effects, makes you sleepy. So if you have to be alert, if you have to drive, if you have to operate heavy equipment or concentrate on any important information, then niquinidol through the day is not the best solution. It's great for relief of night pain. But pain through the day is usually not as bad as pain through the night. And often it can be managed with natural anti-inflammatory herbs like Adeeva's Nature's Relief product with natural herbal agents that block inflammation and pain. If you take 1 to 3 capsules 3 times a day, that often suppresses inflammation and pain sufficiently that you can manage through the day. And if you need to take one of the other drugs, whether it's aspirin or ibuprofen or acetaminophen, at least you're using a dose that's lower. So if you have acute or chronic pain preventing you from sleeping, then niquinidol through the night makes sense. And through the day, I would suggest that you look at some of these more natural anti-inflammatory herbs. But remember, if you're already taking a narcotic drug, you need to work with your doctor to facilitate the transition over to something like niquinidol. But I'll tell you this, in recent years, individuals in society and the healthcare system has paid an enormous price from the overuse of acetaminophen, non-steroidal anti-inflammatory drugs, and narcotic drugs. Studies show that for many musculoskeletal problems and headache problems, some natural alternatives would actually be effective and extremely safe for people to use. So niquinidol for night pain is extremely valuable. But you should also through the day be getting the right treatment. That involves for musculoskeletal problems some chiropractic care, sometimes acupuncture, soft tissue treatments, certain electromodalities, the right rehabilitation exercises. All of these things help reduce dependency on the need for the drugs that are doing most of the damage to the liver, to the kidney, the cardiovascular system, and producing addiction. So the strategy for people in pain, especially musculoskeletal pain, you take niquinidol 1 hour before you go to sleep at night, get the right physical activity through the day, and also use natural anti-inflammatories through the day to try to contain the inflammation and pain to reduce your reliance on some of the harsher drugs that we spoke about. So I hope you found this information to be valuable. If you know someone who has acute or chronic pain, especially if it's keeping them awake at night, please forward this newsletter to them. Thanks so much for watching, and I'll see you next time.